Hey, Dr. Brad Murray. Gonna go through some seated posture maneuvers. I hear a lot of requests for how do I help my posture. I'm in an office job right now. We're sitting a lot more often, and I think we're going to be continuing to be sitting more often for a little bit. So I just want to go through a few maneuvers that can open everything up while you're seated, and this is obviously transferable to all those people working from home or from offices to keep things moving. I suggest going through a series like this every hour of sitting, maybe even less than that, but making sure you're breaking up the day. If you're thinking coffee break time, you should think, okay, here's a series I can go through. We're going to go through 6 exercises for the upper body in the first video, and then the second one we're going to go through some stuff you can do through your lower body, another 6 exercises to keep everything moving so we're not locking up into our sort of chronic flexion positions, which brings me into one of my first areas that we want to focus on from the top down. It's going to be your upper trap muscles kind of come forward with those shoulder blades. We're going to try to create space between the ear and the shoulder blade and the upper ribs to allow everything to sort of settle back down. So how we're going to do this is we're going to make sure we have to anchor our shoulder blade muscles attaching from the shoulder blade going up into the neck, into the spine. We got to keep that guy anchored. I like reaching down a chair leg like this. You can just grab onto the side as long as you know you're keeping that shoulder blade down. You can even use some of the support muscles. Then we're going to bring the head over. We're going to try to keep tall, which reminds me to keep the butt right at the back, right in the corner of the chair. We're going to bring the head over, and we're going to do this for a couple comfortable breaths, or 10-ish seconds. As the breath comes out, that's when you want to try to stretch. And then 10 more seconds where we're fingertip strength. I'm going to try to bring the head over a little bit further. You're going to feel lots of good stretch through here, through the upper trap. You should keep the muscles active on this side. And we're going to be doing both sides with this guy. But I'm not going to do both sides here to keep it a little bit quicker. Let's go through the levator scap stretch. Exact same positioning with this one. This is the second one. Upper traps and levator scap cross each other. And often when you reach back, a lot of people have a common trigger point here. If you kind of got your hands on somebody's traps, it's where those thumbs go for the massages you give when somebody's seated. This is a good way to try to separate the first one, the upper traps and the levator scap, to get a little bit better movement there, or generally tight through where our neck becomes our back, or cervical thoracic CT junction. So this is one way we can help open that up a little bit more effectively. Same position, arms down, heads down. Now we're going to start without the fingertips. We're just going to be bringing our nose to our armpit. This is being locked down still. Trying to keep my spine straight, but trying to bring that nose to sniff my armpit. That's sort of the line of pull that I suggest for 10 seconds. And then we're going to relax and stretch a little bit extra on the out breaths and go through a few out breaths. You're going to feel the first stretch is more right down the side of the neck, and this one's going to go back in a little bit more toward the shoulder blade area. A real common area to get pain and tension. This is a great way to see if you can open the soft tissues up, at least if it is a joint problem or whatever the problem is. Nerves can be compressed through there, through some rigidity in the muscles often too. But first, get the soft tissue moving to see if that helps you out easily done at home. The next one we're going to go to is usually while we're sitting, we can kind of end up sort of slumped or looking over, and that kind of gets everything sort of locked up through hip flexors area. So we're going to sit up straight, and we're going to go through reaches, which are just tilting, opening up the whole rib cage, pushing up as high as you can go on both sides, trying to keep that spine nice and still, head nice and comfortable. Don't be moving the head too much. Often with a lot of motions that don't heavily involve the neck like this one, say you should be able to do bobbleheads. That means your neck should be loose. You shouldn't be all tightened up. Stretching can be uncomfortable, especially if you're not used to doing it, and that can be a problem. So we're going to do reaches. You like 10 on each arm, up to 20 on each arm, really quick. And you feel right away, you feel open after those guys, all the way through a whole area, prolonged sitting, a drive. You're going to feel tight through there. The next one we're going to go is prisoners, which is just the hands behind the head. Trying to keep the head neutral, and don't allow yourself to push yourself forward. A lot of these, you'll see me keep repeating, tall, butts back in the chair, like you got a string on top of your head and it's pulling you nice and tall and tight. That's how you should feel while we're doing these guys. And don't let the positions break down. So prisoners, those hands behind the head, And then you're gonna try to go from what's more of a closed position to opening those elbows as hard as you can. And that should be driven a lot from shoulder blades pulling back, not so much letting the shoulder blades stay there and try to pull the arm back on its own. It's gonna expose the rotator cuff to potential breakdown, which is one of the ways that this shoulder blade really influences scapular problems. Often we're trying to fix rotator cuffs when we should be searching for scapular thoracic problems. So this is one of the ways you can counteract that, learn to get better at it, and also make sure that you are paying attention to how your shoulder blade setting is going through your motion. So once again, hand behind the heads, we're opening up, and we're gonna open up over a 10 count. Breathing comfortably, trying to go a little bit further, feeling the mid-back muscles really grab on to pull you into that full range over those 10 seconds. Those are prisoners. We're gonna open up the triceps now. Work down into the arms a little bit. We kind of started neck, moved into the shoulders, and now we're gonna kind of move out into the arms a little bit more, and we're gonna do a real simple stretch where you're gonna take your hand and you're gonna place it on the center of your spine. It's okay if you're not, super flexible through there to begin with, but once again, we're maintaining that tall spine the entire time. We're reaching back for whatever we get, and then over about 10 seconds, we're gonna do our crawling with our fingertips down the center of our spine while we push this up. No collapsing down, no letting this arm come too far down. Keep that tall posture. Climb down, push back, and we're gonna hold that guy for about 10-ish seconds. Comfortable breathing, trying to go for a little bit extra as you come out once again. Last one's one of my favorites. It's a great one to finish with, and if you're not gonna get through this series, if you feel like it's gonna take you too long, we'd go straight to this one. This would be my sort of shotgun blast up once you get comfortable and get opened up. It's a good maintaining type maneuver. It's named after the guy that first talked about the positions to be in. It's called a Brugger stretch. Basically, it's the exact opposite of the flexion dominant positions that we get in with driving, typing, any sort of maneuver work where we're always working in front of us, things like that, washing dishes, everything's flexion. Predominantly we're flexor dominant. What the Brugger's designed to do is to get those flexion muscles that are overworked and a little tight to open up all the way into an extension position. So how it looks is pretty simple actually. Once again, we're staying tall with this one. Arms are going to be at the side, palms are going to be facing forward, the classic anatomical position. Head's not out. Once again, just that tall stacked position of the spine. Now what we're going to do is we're going to start to sweep the arms back as though you're sort of going to think about sweeping the back of the ground with the back of your hands. I want you to reach down with it. So it's, you're not going to bend down with your spine, but I do want you to feel your shoulder blades dipping down like you're trying to touch your fingertips to the ground. We're going to come all the way back. We're going to open our palms at the back. We're going to try to keep that upright posture, big military Superman chest. Extend those wrists back as far as you can go. You're going to feel the pulling of the nerves, all the tendons at the front of those wrists and elbows. Holding it for about 10. Or even another way I like to always describe my stretches are about 3 good, comfortable, deep breaths where we're going to try to expand or progress with the exhale of the breath. That's the upper body from the chair. We can go through all these guys in our office, and when we take a look at the specificities of each person and what their job demands, what their life demands, there's going to be bigger focus on some of these exercises than others. But this is a really good catch-all. And like I said, the last one, the Brugger, that's a great one. If you're not going to do anything else, focus on that guy. Be safe, be smart, be fit. Thanks for tuning in. High Performance Health, Dr. Brad Murray.